Welcome to yet another interesting episode of the program Community Health. My name is Hasia Ali, your regular anchor. Today in the studio we have Dr. Nura Ibrahim from the Department of Dental Surgery, Ahmadu Bello University Teaching Hospital, Shika, Zaria. Dr. Ibrahim is also a member of Association of Resident Doctors here on Ahmadu Bello University Teaching Hospital, Shika, Zaria. We say a very, very warm welcome to you, Dr. Ibrahim. Okay, Dr. Ibrahim from his department, Dental Surgery, will be talking to us today about toothache, what toothache is and causes of toothache. But before we go into what toothache is, we'd like Dr. Ibrahim to give us a brief on what tooths are or what a teeth is.
What we mean by a tooth, when we talk about tooth, we are talking about the hardest substance in the human body. Okay. Despite it's essential for chewing and also play a role in speech and facial appearance. Okay. Then we have, and also the tooth that we see inside the human body, we have inside the oral cavity, there is different layer that covers it. We have the outer, that is the outermost covering, that what we call the enamel. Okay. And the under the enamel, we have the second layer, what we call the dentine. And dentine is not hard like the enamel. Okay. And also under the dentine, we have the that we call dental pulp. That dental pulp, that will have the blood vessel and nerves inside the dental. It's not hard like a dentine. Dentine, okay. Yes. So we have, and also generally human beings like an adult have 32 number of teeth. Okay. And also children have 20 number of teeth. Okay. Yes. Because the children in human that adult, we have incisors, that's on the upper quadrant we have 4 incisors, and in the lower quadrant we have 4 incisors. Okay. And so we have in total 8 incisors. Yes. Okay. And also the next we have canine. That in the upper we have 2 canine, and in the lower we have 2 canine. That makes 4. And also next to canine we have 2 premolar. On the left we have 2 premolar. On the right, that makes the upper quadrant have 4 and lower quadrant we have 4. We have 4. Okay. Then next to the premolar we have the molars. That we have first molar, second molar, and third molar. That we have 3 molar in each quadrant. Left 3, and on the right we have 3, and that's making 6 on the up and 6 down. Okay. That's making 12. Okay. Why in the young children? That's what we call deciduous teeth. And that one we have incisors, that we have 4 incisors on the off, we have 4 incisors on that, and we have canine. And they don't have the premolars, but they have 2 molar, first molar and second molar. Okay. That's briefly. So the layers of the teeth that I have already discussed, we have enamel, we have dentine, and we have pulp. Then we have cementum. That is tooth supporting structure. So we have cementum. That's the popular one they call gum, right? Yes, that gum is part of the tooth supporting structure. The gum we call the gum. That gum is gingiva. Okay. Apart from that, under the gingiva, we have periodontal ligament. Then we have alveolar bone, the ones that support and hold and support the teeth. That's it. Okay. Yes. Thank you. All right. Having said that, while you were discussing, you said the teeth is actually the hardest parts of the human body. So you're trying to say the teeth is actually harder than the bones? Okay. Well, a lot of us do not know that until today. All right. Then now let's look at what is toothache. What is toothache? Toothache means it's the condition that affects the teeth and surrounding structure. Okay. And also it's the most common thing that cause patient to seek dental consultation. Yes. So toothache, there is different, and also there is different type of there is different cause of toothache. That's what makes the patient to feel pain. Like maybe number one, we have if the patient having poor oral hygiene, so there is possibility of deposit of the plaque and calculus. When that plaque and calculus accumulate on the teeth, and that lead to that lead to the gingivitis. That's the gingiva. You know, we'll talk about the
gingiva earlier, yes.
So the gingiva explantation, he said that lead to toothache, and also means the bleeding, and also dental caries if the patient has, and also even that plaque aciculus may lead to dental caries, because if there is accumulation of plaque aciculus that lead to bacteria to that make the bacteria to ferment that carbohydrate and produce acids that lead to erosion of the enamel and to make a hole, and that hole that makes the patient to have the vein toothache. Yes.
So now what we're saying here is it every toothache that comes with a hole in the teeth, or you can have toothache without hole?
We have toothache without hole.
Okay.
That's why I say number one, if we have dental caries, that is the hole. That's what we call dental caries.
Okay.
It's to toothache. Then number two is even trauma. Trauma can cause toothache.
Wow.
Sometimes the patient bite and so hard substance. If the patient eating food, maybe eating rice or local rice, it's little toothache. Sometimes that when you lead the patient to have to go seek dental consultation.
Okay.
But sometimes the patient would not like that. That was that thing. And also, like I told you, gingivitis. If the patient has the inflammation of the gingiva, it will lead to toothache, but not cavities. And also, if the patient, the gingivitis, also periodontitis. Periodontitis, like inflammation of the inflammation of the tooth-supporting structure, like periodontal ligament, all the alveolar, it lead to toothache.
Okay.
Yes.
So, having said so much about toothache, and you also touched a little of causes of toothache. Now, let's look at the symptoms of toothache. What are their symptoms?
Sometimes the patient presents with, when the patient presents to the clinic, he tells you he have toothache. And also sometimes you are going to ask, is this disturb your sleeping? Yes, sometimes the patient says toothache disturb his sleeping, he cannot sleep, you have to take drugs. And also, yes, he said you have to take drugs before he sleep. And also the patient is associated with the pain. Even he says the pain is radiating. He cannot even localize the place. He can't localize. He say he just point out. He says this about you cannot which particular tooth is paining. Also also sometimes that's associated with a headache and also fever. Yes.
So you can have fever when you have toothaches.
Yes.
Wow.
Patient may have a headache, fever, and also it depends on the cause of toothache.
Okay.
Because sometimes you even have patient may even have halitosis, that mouth odor, especially if they have cavity on the teeth and your tooth used to pack inside the cavity, and sometimes you look to the patient tell you have when he open his mouth, people say you have mouth odor. So that can cause that thing. And also it depends on the cause of it depends on the causes. And also sometimes if you're having inflammation of the gingiva, he lead to salivation. He say always saliva will come out of his mouth, and even that one can lead to that condition. And also patient will tell you that he cannot take cold water. If you take cold water, he having severe toothache, because sometimes it's sensitive to cold or hot water. And also even eating. Sometimes if the thing is severe, he cannot eat. Yeah, it affects you have to come and see dental consultation.
Okay. Now let's look at what are the presentations for toothache.
Okay. Like presentation is the same, like I tell the patient present with toothache, swelling. Sometimes patient will because the tooth little, because the tooth initially the tooth start from the enamel. So if from the enamel to the dentin the thing is not much. You can, if the patient limit you can give him drugs and please the tooth, but sometimes it affects the fourth. From the part it lead to go down to the periapical region, that between the teeth and the alveolar bone and the bone. So if there is pus, the pus will lead to swelling around. The pus will affect from the bone to the soft tissue and the swelling of around the area. Patient may have the present with swelling around the area. So, and also sometimes if they didn't treat it, it will lead to the condition that we call facial cellulitis. The whole face will become swollen. Yes. So that if it becomes swollen, we didn't take care early, it will come down to the neck and swell and block the airway. So that one is an emergency, because if you didn't take care of the patient, in a few hours or some minutes, patient can die.
Yeah. Wow.
Yeah. Wow. So that's why the patient have to seek dental consultation to see to how to manage that and before it led to that complication. Sometimes it will lead to even swelling around the period. If the thing went up, it will lead to what we call cavernous sinus thrombosis. That inside the patient, he said, if you've been how his eye
wants to fall out of the socket.
So that patient will lead to that. That will lead to that. And all that presentation of the patient that we came with today.
Okay. So now let's look at the treatment modalities for toothache. Are there treatments for it? Okay, what are they?
So there is different type of treatment.
Okay.
The number of the patient present. Sometimes you have to the different type of what. Sometimes the patient is having to. Initially, we have to give the patient. We have to teach the patient about the prevention. That is better to prevent. How to prevent that. After you talk about all these things, you advise the patient to go and do cleaning, that scaling and polishing every 6 months. It prevents that toothache. Then second thing, you ask the patient to brush twice in the morning, and even it prevents that thing. And also, you can even check if the patient. Some people that have deep picture in their teeth, especially the back teeth, that's what we call molars. Some of them they have deep picture. So if the patient has, sometimes that deep picture that lead to put to go and pack inside of the picture. So sometimes there are one treatment called pit and picture sealing. So that with that we prevent that put to packing on that picture, so that the patient will not develop that toothache. Yes. So then, if they already have caries that lead to it, then we can we can take the radiograph to see the depth of the caries. It didn't impose the pop. We just do simple peeling. And the thing. Well, if the thing gets to the pop, there are different types of treatments. There are one we call pulp capping, pulpotomy. If the thing is, it just pinpoint a position of the pulp, so we can do pulp capping. If it involves the pulp, we can do pulpotomy, and also we can do root canal treatment. If it involves the root, then we have to do root canal treatment. Then and also if the teeth, but there are teeth that cannot even restore or not restorable to them, we have to remove. We have to extract the teeth. After extraction, then we give the patient bench.
So you talked about the treatment, and you touched a little of the presentation. We talked about the treatment, and while talking about the treatment, you talked about some prevention. But now I want to talk a whole lot on prevention. How do we prevent the toothache?
So, like I have told you about that thing, to prevent the toothache, there are different prevention. Like number one, proper oral. If the patient maintain proper oral hygiene, then and also second thing, especially in the children, there are what we call fluoridation, ways to give and also let's talk about that in detail. Number one, there is one we show to straighten the horse, that is the patient. And like if the patient, like I said, if the patient have that deep picture, we can do picture sealant, and also we can do fluoridation. That's the fluoride, because if the teeth is not hard enough due to the deficiency of the what we call fluoride. Weakens it. So rather we can do fluoridation, that we do it in the dental clinic. In our dental clinic, we have acidylated phosphofluoride gel that we used to, especially for children, we used to do that fluoride application topically on that patient in the dental clinic. Then and also number two, we can do mechanically, like we say that we remove the microorganism by doing tooth brushing, and also we use that one by using scaling and polishing. So that we do professionally in cleaning. That we want the patient to come every 6 months. That is recommended every 6 months patient to come and do scaling and polishing.
This coming 6 months for patients who have toothache, but generally, are there times that people without toothaches should actually visit the hospital for maybe checkup to be sure that their tooth are fine?
Yes, that's why I say even if you don't have toothache, every 6 months is recommended to go and do scaling and polishing. Every 6 months. Yes.
So now let's come to the part that a lot of people dread. You find a lot of people, when you talk about removal of teeth, they say, no, I don't want to get my tooth removed and all that. Could you please tell us this removal of teeth? What are the benefits and the disadvantages of removal of a tooth?
Initially, we don't want to remove it.
Okay.
Because no matter how the teeth is bad, we can
manage it.
To continue using it, because the cost of replacing it is more than the cost of repairing it.
Okay.
And also even the function, because you cannot compare natural one with the one that artificial. No matter how the tooth, actually if the infection down to the alveolar bone that lead to even we can do what I will tell you, the root canal treatment.
Okay.
Or that after we finish that root canal treatment, if the crown we can do the crown. If the crown of it already broken down, we can do the
crown is the part that is up, you know?
Yes.
Okay.
We can do the crown to cover after the root canal treatment. We can do the crown to cover the teeth.
Okay.
Yes, and the teeth become functional again.
Okay.
Yes. So that's the benefit of saving the tooth, because it helps you for aesthetic, feeding, even speech, and also even the preserve bone, because by the time you remove the teeth, the alveolar bone start receding, start going down, because most of the people, old people, if they don't have to see all their jewelry becomes and also they cannot even if you remove some teeth, you can do that. Some words I cannot pronounce.
Really?
Yes.
Okay.
That's why it's important in speech, because if you can decide, some people that are especially fronty, they have problem with speaking. There are some words that cannot pronounce
properly.
Yes,
Okay. So now,
and also if the teeth, but there are teeth that are called hopeless teeth that you cannot restore it. That is why you have to remove it.
Okay. So now,
okay.
The ones that are hopeless are the ones that would be removed. The ones that have hope can be managed and fixed, okay? So now, having said that about the removal, now let's talk about refilling of tooth. For those who have holes in their tooth, at what points do they have to fill the hole? And, sometimes they say, okay, the hole is not so big, we can allow it like that, we don't have to fill it. So what can you tell us about filling of the tooth?
No, we cannot say that we cannot visit it, whatever. That I tell you, even those patients that have molars, I talk about molars, there are some that have deep piju. So even that one, even with alcohol, we can do what we call pit and piju sealing. We can even seal that, we can even peel that one. And also, no matter how the care is, even if it's in the enamel, then we can do the peeling. We can just do like glass and normal cement to peel it, and the patient will go out and continue using it. Okay. But if the thing getting to the dentist, that's another thing, because the different peeling. That one we have to do. Especially we have to do pulp capping or whatever we have to use. But if the thing get into the pulp, that's why we have to do endodontic treatment. We have to do the treatment to the pulp, then we can restore the teeth.
Okay.
But whatever small the hole is filling, because there are some materials that we don't. Initially, we have to drill. We have to use our board to drill to increase the hole before you. But now we have materials because we have material that adhesive material. So no need you just use to fill it and thing will stay.
Okay. Now, aside refilling the tooth, people have this impression that if they refill a tooth, that while brushing, like it's gari, the powdery substance they use in refilling, while brushing continuously, it keeps scraping off. And there's this mentality of if you refill once, you have to continue refilling, because there are sometimes the refilling will fall off. How true is this statement?
No, it depends the type of material. Sometimes you use temporary filling. So that temporary filling material, you just this one is temporary. We just after 1 week or after 2 weeks come to do the permanent. But permanent one is not some gari come. No, permanent is not like family. But temporary filling, that how it's one is. But permanent is not
like that.
And so the temporary one, even if it didn't come, it's likely removed. But permanent, it's very rare. Sometimes it come, it's poured out because the cavity is shallow, and also it didn't prepare well. It did the peeling, it didn't did well. It will come back. If it's well did, can still sometimes some patients can tell you have peeling for 20 years.
Wow.
Yes.
Wow. Okay. So listeners, if you are afraid of refilling a tooth because you feel it's going to be a regular process, now the doctor in the house, Dr. Ibrahim, has enlightened us about refilling of our tooth. So it's not something to be afraid of. So if you have a hole in your tooth, youth, try and visit the teaching hospital, Department of Dental Surgery, where you will see Dr. Ibrahim Nura to help you, to tell you what to do to that particular tooth. So now, Dr. Ibrahim, before you go, please, we'd like you to give us a take-home message to our listeners. Tell us an advice to the general public.
So my advice to the general public is that you have to maintain their oral hygiene, because the mouth is the pathway to the systemic health, because there are link between the mouth and the systemic health. Most of the systemic diseases first show their sign on the mouth, and also that especially, and also that bacterial, all this infection in the mouth will take, especially people with heart diseases, there is connection between microorganisms in the mouth and heart. So if you maintain your proper, while time you maintain your proper oral hygiene, and also even that will give you to have your systemic health to be safe. And also, so that's why we recommend the people to brush their teeth morning and last in the night. And also, if they have any problem in their mouth, they just go and visit dental clinic to see before the condition, because especially those people with cancer, all that mouth cancer, all that thing. If the thing, even if the toothache, all that thing, if the thing is diagnosed early, it's more easy to prevent to treat early before. But if the thing become worse, so that thing, if you didn't treat it early, so the thing will lead to more problem, more cost, and it's even your body is so that's why you need early consultation and treatment.
All right, thank you, Dr. Ibrahim. Well, as we always say on this program, we say prevention is better than cure, and your health is your wealth. The earlier you visit the hospital, the cheaper the treatment is, and the later you visit the hospital, the more complicated the issue is, and the more expenses you inquire during the treatment. So, listeners, it's been Community Health from your most dependable radio dial, ABU Samaru 101.1. We've had Dr. Nura Ibrahim from the Department of Dental Surgery, Ahmadu Bello University Teaching Hospital, Shika Zaria. He's also a member of Association of Resident Doctors, ABUTH. We say a warm thank you to Dr. Nura Ibrahim for coming. Thank you so much, sir. You're most welcome. So, listeners, join us same time, same station next week for yet another interesting episode of the program. I still remain Hasia Ali, your regular anchor, saying goodbye. Thank you so much, sir.